we're back and we're moving into our second conversation for this morning. And we did have a very extended first segment with our frontliners from the KHMH COVID unit. So first of all, Dr. Johnson, we do apologize for the delay, but of course, appreciate you being with us. The Dean of the Faculty of Health Sciences at the University of Belize, Dr. Lisa Johnson, with us to talk about a recent presentation that you did on health and development in Belize. Good morning.
Good morning, Marlene. Good morning, Gavin. Thank you very much for having me and for asking about this lecture that we university did last Wednesday night. Thank you.
Yeah. Now let me just tap into some of your experiences here, Dr. Johnson. I know you were tuned into our previous conversation. You did for some time work at the KHMH as well. What's your thoughts on what our nurses are expressing?
This does not come as a surprise to me. First of all, what you saw represented there is the epitome of nursing professionalism. And it's not only a matter of training, it's also a matter of character and integrity. These are very important characteristics for healthcare professionals. And you saw that in spades being represented in your previous segment. Mm-hmm. The pressure is on. It has been on them for more than a year. And we have to recognize that they are human beings and that they need support not only to the tools to perform their duties, but we need to support them through this time. This is going to produce post-traumatic stress syndrome disorder in a number of our frontline workers. It is unavoidable. Mm-hmm. And we should be trying to take steps to support the mental health of those people who go into battle day in and day out.
Mm-hmm. And I suppose that, having said that, it puts into focus, or at least the presentation that you gave is a very timely one, because, nowadays, the spotlight has been on healthcare services and the healthcare profession in Belize for probably the past year and a half. So can you describe a little bit about, or can you just for our viewers, the presentation you gave?
Well, I was asked to do this in celebration of our 40th year of independence. And I had a unique view. My mother was a nurse. My mother eventually became the principal nursing officer of this country. And so my view of healthcare in Belize started at birth and proceeded forward. And I was fortunate to be able to be in the company of formidable people, your grandmother included. Formidable. There was just no other way to describe them and how they carried our healthcare system at a time when we did not have a lot of doctors in the country. And so we've come a long way, and we've come a long way on the strength of nursing in this country. Nursing and pharmacy, because we started training nurses and pharmacists in this country decades ago, and then eventually started training our own medical laboratory scientists as well. And so we have a foundation on which to build on. And then we went into the era of acquiring of more Belizeans being trained as physicians, and eventually that population of physicians extending out into the entire country. And at the same time, as that was happening, we then went through. So we're coming from mobile clinics to physical clinics,
Yeah.
to a system that was also rooted in the public health inspector and the rural health nurse and the community health nurse.
Yeah.
And then you had the district town hospitals run again by formidable women, who saved a lot of lives in this country for many, many years. And then we started to get more doctors. More doctors went out into the country. And then came healthcare reform. Healthcare reform is what created Carl Huchner and the authority that runs it. And that should have also been accompanied by a significant upgrade of the regional hospitals,
Yeah.
as well as the community hospitals. So in a nutshell, that's the system. But I think what we need to understand is that running a hospital and running a hospital system is a different discipline from public health. You cannot approach them in the same manner. The information that must be at your fingertips is different, to competently run a hospital. And you have also got to, when you're looking at a hospital, the people, the staff, the employees of that hospital, from the kitchen to the housekeeping, to the maintenance, to the biomedical maintenance, to the oxygen supply, to the piping, the plumbing, everything has to work together.
Yeah.
And so any bad decision within a hospital goes directly down to the patient.
Yeah.
And we have to understand that. And so that is why I concentrated on separating the two.
Yeah. Yeah.
So that we understand what we need to understand, that full attention needs to be given to hospital and full attention needs to be given to public health. They will work together, but they are different and they have different goals, different initiatives, and different principles of operation.
And objectives.
And
Because
objectives.
Public health can be a great preventative tool that you don't need to access
Yes.
the hospital system. It's
Right.
when I look at your presentation, I think one of the things that it triggered for me is one thing. It's hard to imagine our healthcare system or in the country collectively, public health and hospital care, outside of this pandemic. But there were struggles before, and I think what this has done is really just been an exposure of where we have lacked proper planning and investment in our healthcare
Yes.
system, and thinking of the growing population and the growing needs we have. One of the things is looking at what we now call our high-risk population for COVID-19, people who have non-communicable diseases. We've talked so casually about pressure and sugar, and we didn't really spend a lot of time focusing on the whys of the increase in this population and what we can do to prevent it. I thought that was a really interesting aspect of your presentation. Do you want to dive into that a bit more?
Sure, because we have to remember the principles of public health have not changed in the last 100 years. Prevention is better than cure. Get something done early before it's too late. And while it's easy for the population to look at infectious diseases, we have to remember why people are dying in some cases from COVID, or in most cases because of the presence of diabetes, hypertension, heart disease, and cancer. And public health and research has established that if we can train ourselves to have a healthy lifestyle, healthy nutrition, proper nutrition being the key to that, the access to vegetables, fruits, good quality food prepared in a healthy manner, then that is the basic foundation of having a healthy lifestyle and preventing people from becoming what the endocrinologists would describe as a pre-metabolic syndrome, which would then lead you into diabetes and hypertension and so on. And there's a lot of interesting research that I'm looking forward to. I'm hoping coming out of the Caribbean, where we're trying to figure out why Black people in particular in the Western Hemisphere react differently to medications than Africans and Caucasians. Mm-hmm. And so we've known for quite a while that, for example, prostate cancer behaves differently in Black men than it does in Caucasian men. We've known for quite a while that the regime for hypertension should be different for Black people in the Western Hemisphere than for Caucasians. We've known all of this, but now we need to get to now that we have access to our genetic information, we need to understand why that's happening. And I think when we key in that type of research with really good health education programs, which start from the womb, extend into the school system and beyond, then we can combine these initiatives. We will then start to see a difference in the numbers. But education itself is an important component of all of this.
Well, here's the question, though, because I got to dive in there. I think we had, it may have been Ministry of Education or the teachers when they were talking about the curriculum development, but it's always falling back on teachers to provide extra information to children as they grow. And I agree with you. We've never learned, we learned kind of just the very basic of a balanced diet that maybe will get you through a test. But ask somebody today what your plate should look like or what vitamins are needed, not needed. You know, it's an unknown factor. We can be sold anything in a bottle and believe it works. But can it only be through the school? I mean, how do you make this shift to realize that early behaviors, early good habits will make a big difference in what type of diseases you'll develop in some people as early as 20s and 30s?
Well, it's not only the schools. Everything starts with your parents. And while I'm not a sociologist, I certainly have some views regarding parenting and how a child should be brought up. I think everything that I have and I am came from my parents. Mm-hmm. And by them and I'll take the former Secretary Clinton's view of it, my village and the village that raised me, those people who were in my life from before I even got to school. What the formal system does, it's ought to be cementing what is learned at home. Yeah. But if it's not happening at home, then yes, it unfortunately drops back on the system. What many people don't realize is that at the clinics, the polyclinics and the NHI clinics, there is a significant amount of health education that takes place there. Yeah. When you are sitting there waiting under normal circumstances, not COVID, but under normal circumstances, when people are waiting to be seen at their health center, either the community health nurse or some other public health provider will conduct short educational sessions with their patients. They discuss nutrition, they discuss vaccination, they discuss, for example, the Well Baby Clinic when a child goes and you check all your milestones, they put them on the graph, make sure that they're not slipping into malnutrition. All of this is a part of education, and I think what happens many times is that people sit there, the information goes in one ear and out through the other. The information has to be held within the brain, digested, and have it affect your lifestyle. If the information is there and people are making conscious efforts not to appreciate the information, I'm not sure what we can do about that.
Yeah. Well, it's a cultural shift that must take place. Let me throw this question at you. Do you agree that with all the tragedy we see with COVID-19 and the challenges we're facing, that the silver lining is that healthcare is now in our direct focus?
That is a silver lining, and my concern is how long look what it took to get the attention, and how long will the attention be held once this goes away. And healthcare must be something that our entire society is on the same page about. If we're not on the same page, we are going to continue to have problems. And then when COVID goes away and the pressure isn't on, then my great fear is we go back to our previous outlook and actions.
And just to shift gears a little bit, one of the aspects of your presentation that I found really interesting was in the context of public health. You spoke about violence and injury prevention, and that's not something that one would automatically associate as a public health issue. Can you talk a little bit about that for our viewers?
Sure. As I said in my presentation, I am a trauma surgeon, and my job can be eliminated because violence and injury are preventable. So from a public health standpoint, a number of countries have taken different avenues, but they've all recognized that it is a significant sociological problem. And so they have taken steps to look at it that way. We already acknowledge the importance of prevention in our laws. We have road traffic laws that govern speed, the wearing of helmets, and that you need a license, and that the car must be inspected. People may have the idea that we're doing all of this because we feel like, or in order for city council to make some money. No, this is public health. Mm-hmm. If a vehicle is not properly maintained and malfunctions on the road, it is a danger not only to the driver and the occupants, but to the other people driving on the road in the vicinity. Yeah. So that's public health. Yeah. When we insist that that people who are on motorcycles wear helmets, that's public health, because motorcycle accidents eat up a lot of resources. Yep. In the United States, this law actually was challenged it went very far in their court system. And when the argument that was used for the helmet law was the average amount of money that it took to take care of a motorbike accident patient who had experienced a head injury. And we realized that it was pulling significant funds out of the health system, funds and resources that could be used for other things.
Let's talk about gunshots in Belize and how it exhausts our blood blood bank.
Exactly.
Is it 10 units of blood for one gunshot victim that would be used in like an emergency case? I think that was a number that was quoted to us a while back.
And I will tell you that 10 is an infinitesimally small number per person. We only give 10 because that's all we have. When I did my trauma fellowship in Toronto, The first multiple trauma patient received where I was the trauma team leader that led that resuscitation and care, that patient received 56 units of blood products. 56 in the first 12 hours to get that patient stabilized into a 64-slice CT scan and then onto the operating theater and then into the trauma ICU. It took 56 units of blood products just to achieve that. And a hematologist, a specialist in blood, was standing by my side every step of the way. So we only give 10 because we only have 10.
Yes.
And people don't understand the resources that are actually required to deal with a trauma victim.
Yeah.
And so the sociological issues need to be addressed.
Yeah.
The cause of the violence, whether it's domestic violence, rape, gender-based hate crimes, gang-related. We have to address this. Or while we are trying to deal with one pandemic, the pandemic that was already with us is still will return.
Yeah.
And that's what injury and violence is. It's a pandemic.
So what do you think, when you in giving your presentation, it's an opportunity to identify or allow us to divert our attention from just COVID-19, which, taught us about pandemic preparation and public health measures, but also to not lose sight of the fact that we have been battling these other pandemics along the way. How do you pivot? How do you think we can pivot as a country at 40 years old into taking, as I said before, the now focus on healthcare and recognize gaps like nursing shortage, like proper flows, early interventions and preventions? How do we pivot in that direction? Is it all about money? Because, you know what the answer there is going to be.
It's not all about money. It is about the will, and you can describe that will however you want to. It is about recognizing what are the key elements. The key elements for us as a country are our people, both the people that we train and the society at large. I think from the public health aspect, I would say that we need to be more in tune with the public health system. And that's because our population has grown. So we don't see and feel public health and how it is working to sustain us now that we're almost 400,000 population. Before the system and the people interacted much more effectively and much more personally. And I think sometimes it takes one-on-one conversations, one public health official to family, public health official to community. It takes the personal touch, and that's what I would want to see, that the average Belizean home, yard, school, and so on are aware and feel the presence of public health.
Yeah.
Right. And as it relates to our hospital systems, we need to this is where my idea of the university hospital for Belmopan, which would then take over the referral of patients from Punta Gorda, from Stan Creek, and from San Ignacio. And that, so along with that would come investment in training. Now, this is where, of course, you're going to need funding to do that, because we need to employ more educators in health sciences. We need to develop add to the universities teaching resources, laboratories in particular, nursing labs, pharmacy and pharmaceutical labs. We have a lot of research to do, and we need labs to do it. And also extending the medical laboratory that we have at the university. It's tying in all the different parts of the health provider team under one roof that has standards of care as its foundation. And the goal being that we are providing both training and service to our community. And because the more we engage with our community, the better we will be able to serve them.
Yeah. All right. Well, Dr. Johnson, I know this just scratches the surface of your presentation. We tried to cover some of the highlights here, but people can know that the lecture is online, so they can go back and they can watch the video and hear more of your ideas as to how you see health and development in Belize at 40 years and beyond. Any closing thoughts?
I would like to say that I continue to encourage everyone to become vaccinated. I continue to encourage everyone to support our frontline workers. Everyone working in a hospital is a frontline worker. Yeah. The police are out there, they're frontline workers. The teachers, they're out there, they're frontline workers. Please do everything that we can as individuals and as a community to help them do the remarkable job, in particular those who take care of COVID patients, remarkable job that they are doing.
Yeah. All right. Thank you so much, Dr. Johnson. We appreciate it, and stay safe.
You too. Thank you.
All right. We're going to go ahead and take a break, and we'll be back shortly, so stay tuned.